Good afternoon, everyone. Thank you for joining this interactive session on patient collection. I am Marcus, your host for the day and customer success manager here at Capline Healthcare. So let me introduce you about who we are, what we do, and how we can help you in managing the patient collection effectively. Let me tell you about our company first of all. So we are Capline Healthcare Management, and we are working for more than 700 practices across 50 states. We are headquartered in Houston, Texas, and we have highly skilled team. We possess extensive experience in managing more than thousands of applications across the United States. So now let's understand the goal of today's presentation. So we'll be understanding the effective ways of managing patient collection across your practices. So we'll understand the impact of improved payment systems on practice revenues, how we can increase it through improved payment systems. And lastly, let's learn about practical steps on how we can implement better payment options for payment collection strategies. So let's begin on how we can ensure that your practice is making maximum revenue from your patient collections. So we'll specifically talk about patient collection here, not about the insurances. So there are basically three major challenges that every practice or we even face while collecting from your patients. So the first and the foremost is delay in payments due to unclear billing processes or financial constraints. And second is high rate of payment denials and that disrupts the cash flow. And lastly, the third and the most important is complex billing systems that we have introduced in our practices that does not allow your patient to understand the billings easily, and they do not allow your patients to understand what they owe and why they owe. Now, what is the importance of implementing effective payment collection systems? So we talked about the challenges that your client is facing, your patient is facing. Let's understand about the importance of having effective patient collection methodologies or strategies. So the first is it enhances your patient satisfaction. Second is it minimizes the loss of revenue. And third is the most important, it reduces the administrative burden on your staff because your staff has other things to do as well, booking appointments, scheduling them, and taking care of collection from the insurance company. So multiple things. So let's understand how we can implement all these practical and beneficial strategies in your practices to improve the patient collection. Now, we're talking about improving your patient collection. So how this can be done? The first and the foremost thing is introducing digital payment channels. So the digital payment channels like online payment portals, introducing online payment portals where your patient can log in at his or her ease and make the payments. Second is mobile payment solutions. They are on their phones. They can pay, they can log in, they can check the invoice and pay easily. And third is we need to introduce automated billing solutions or payment plans so that patient has an option of pay has an option to pay easily with the effective payment plans in place basically. So what would happen if you introduce all these steps? It would add convenience to your patient. The accuracy would increase, and the speed would also be better as compared to sending the manual bills because patient has to receive it first and then go through it. No clarity on the paper bills. So online modes will definitely add to the speed, to the convenience, and to the accuracy as well. So we have talked about digital payment methods. That's one of the way of improving your patient collections. Now let's talk about implementing effective payment strategies, payment collection strategies, basically. So ensure that there is a clear and concise communication with your patients about the services which are not covered in their policies and how this can be done. This can be done by making sure that you have a proper insurance verification service available in your practice so that when a patient comes for booking an appointment, you actually have a clear understanding of what services are not covered. And the services which are not covered, you can ensure that your payment, your client can pay it initially because client has to eventually cover the out of pocket expenses. And we need to have multiple payment options so that the client doesn't feel a burden of paying the out of pocket expenses. So always ensure whenever your patient is coming for the treatment, you have actually figured out the services which are not covered, and you can make sure that you're able to claim that money from your patient upfront. Now, what happens if your practice does not implement these solutions? So we have done a survey we are working closely with many practices, and we have found that the chances of collecting increases by 70% from your patients if you're collecting from your patient upfront before entering the treatment once the patient is coming in for the service. Because this would be only effective, this would be only applicable if you have actually done the verification well in time and accurately, rather than the chances of collecting after the patient has left your practice will only be 30%. So it is always advisable to do the collection initially in the first place. And if you're not implementing these practices, the percentage of collection would definitely reduce, and that too drastically. Now let's understand about best practices that you can implement for higher collections. So first, the most important is education and training. Always ensure that your staff is well trained and they're educated in how to handle difficult conversation with the patients effectively, professionally, and empathetically. Because only if the patient is able to connect with the practice, with the front staff, or with the person who is conversing from the practice, only then the client will have that trust in making the payments. Second is use of modern technology. We discussed about online digital modes. So you can introduce credit card machines to pay easily through their credit cards or debit cards or whatever card they possess. Or payments like online payment methods, self-serving kiosks, IVR payment portals. And even after all these, you're implementing good communication effectively, professionally, offering multiple payment options, and still then the patient is not paying. The third option is sending those accounts to the collection agencies because they are legally authorized to collect from the patients through different modes. And even if they're not paying, they have authority to forward those patients' accounts to the credit bureaus. They can report it to them. And trust me, after it's sent to the collection agencies, the patients have paid drastically. Patients have paid, and a lot of I can say around 70 to 80% patients would definitely pay if the account is handed over to the collection agencies. But we need to ensure patients don't reach out to collection agencies. We are able to manage and collect from the patients before that, well in advance. Now, we have understood about the effective ways of doing it. We have understood about the digital platforms. Now let's understand, when you'll be making calls to your patients, how you can make those calls really effective in the first place. So first and foremost, it is, let's prepare for the call that you're making out to your patient. So we need to ensure that you are already set with the information in front of you before you're calling your patient. So information like, you need to gather relevant information like the bills on time, supporting documents, the treatment notes, or patient account status. All this information should be in front of you at your fingertips while you're calling your patient, so that if your patient has any question there and then, you don't have to make your patient wait, and you answer those questions well in advance. The second is, after you have called the patient, the initial contact minute has been made, you are able to talk to the patient empathetically and professionally. We discussed that earlier. But you need to confirm the payment status and confirm the patient if the account is delinquent or not. If yes, then what is the exact amount that the patient owes? Secondly, always ensure to take the name of the person along with the title, and always make relevant notes to ensure that you know whosoever will be the right person for all future references. Now, let's talk about patient-friendly payment options, basically. So the friendly payment options would be nothing more than what we discussed earlier, like IVR payment options, credit card machines, flexible payment plans we can introduce, and credit card machines at your practices, online portals. And after all this, we need to have a positive, the patient should have a positive experience throughout the patient interaction. So your client or your patient should not feel like the call is all about money. So they should feel touched and connected with your practice. Now, let's talk about patient-friendly communication, how we can establish a friendly communication with your patient, whether it's the doctor who's calling, the front staff, or the office manager, or even any third party with whom you are in collaboration with. So we need to ensure this communication should be effective and it should be friendly, basically. So always ensure that the bills that you're sending to your patients are clear, concise, and easy to understand. It should not be difficult, because you and us are professionals and we can understand the terminology, but not the patient. So it should be very easy for the patients to understand. Secondly, provide tools for self-serving. Your patient should be able to log into some portal if you have it, or some online portal where they can log in, easily make the payment, understand the breakup of the invoices. And third is, Offer discounts if the patient is making an early payment. And if the patient is not able to make an early payment, there are certain payment plans available for the patient to make the payment with ease. Now, we have reached out to the patient. The patient has paid. What next? Always ensure that you're taking feedback from your patients. You're sending out service to the patients because if they give you a positive feedback, that will definitely help you to improve your services and improve the collection or improve your quality of call for the next collection calls to the next coming patients. That would definitely give an upper edge, and you will have an understanding of what went wrong with the previous patient and how this can be improved. Now, let's talk about payment plans as well. We have to make sure that we have payment plans and option in place because not every patient will be able to cover the out of pocket expense easily and in the first place. So we need to offer payment plans for easy reimbursement option, for immediate reimbursement options, and managed repayment plans. And also the payment plans should be for the benefit of the patient, basically, how easily they can pay in installments. Second is we need to ensure that the payment plan is in line with the terms and condition and policies of the insurance company, as well as your office, as well as your practice. Great. So we have given payment plans. We have taken care of all digital methods of making the payments, online portal access, everything's discussed we have done for the patients. Now let's talk about the patients who are very difficult to handle or difficult to explain them the payment terms or difficult to collect from them. In that case, always ensure that you maintain a calm and professional tone, even if the patient is rude. We have to ensure that our money is with the patients and we have to take that from the patients. So always ensure to have a professional tone with the client, and not only professional, but we need to be very sweet with your patients, with our patients rather, and always communicate effectively with the patients who claim that they have never received the bill. So always ensure that the bills are with the patient when we are calling them, so they can understand and relate to the numbers that you are portraying on the call with them. So patients should have an understanding on the bill that has been sent to them with professional tone and attitude. Great. So here I'll take a break before I conclude what we have discussed so far. And I'll wait for a minute here. You can go through the testimonials. And if you've got any questions to ask, you can reach out to me. I'm waiting for you. Let me conclude what we have discussed so far so that I conclude in a nutshell, you have a better understanding of what we did so far. So first and foremost, it's always advisable to take the upfront payments from the patients so that your collection rate increases. And as we discussed, 70% of chances you collecting at the time when you are giving the treatment to your patient rather than collecting when the patient has left, because then the chances will be only 30%. The second is always offer different payment methods, loans, or payment terms to your patients to ensure that they're able to pay well in time and without any burden with ease. And third is train your staff and always create proper bills or automated systems wherein patient can understand properly what is owed by them and how they owe. Great. So that's all what we have discussed so far. This is the conclusion of it, and how these are the three major steps that you can follow to ensure that you're increasing your collection rates, specifically talking about the collection from the patients, not from the insurance companies. Great. So you can see our contact details, our number, our email address, our website. You can go through it, make a note of it. Whatever we have discussed right now, whatever we have understood right now, a copy of it will be mailed to each one of you who is joined right now. And you can reach out to me or my team anytime if you feel need of any services or you want us to help you with anything as such. Thanks a lot. And I would request you to please stay tuned. You'll receive the copies of of this presentation, and always stay tuned with us for the next webinar or the next informative session on the next topic that we'll be discussing or forwarding with you. So let's connect next time for an interactive session. Thank you.